we have received funding through the Department of Defense to conduct a phase 2 single-arm trial called IMPROEV. And in this trial, we are including patients with metastatic or locally advanced urothelial carcinoma who have not previously received systemic therapy. And patients will be receiving 6 cycles of induction, Enfortumab, vedotin, and Pembrolizumab. Patients who have a CR or a PR will be discontinuing Enfortumab vedotin and will be continuing maintenance Pembrolizumab for up to 2 years. And the primary endpoint of this study is 18-month progression-free survival. Sort of the rationale and background for doing this study is that we know that Enfortumab vedotin and Pembrolizumab are very efficacious regimens. But we do know in clinical practice that administering these drugs until a patient is not able to tolerate it due to toxicity is not a very feasible option clinically because patients have a lot of neuropathy and other toxicities, more from Enfortumab vedotin, which leads to drug discontinuations, and some of the toxicities do not resolve over time, for example, the peripheral neuropathy. But we also have data available from numerous trials, including EV single-arm phase 2 trials, EV201 cohorts 1 and 2, as well as with EV302 data, and also with phase 2 single-arm EV Pembro trials, where patients who discontinue Enfortumab vedotin, possibly due to toxicity, continue to experience disease control beyond discontinuation. Based on that, and also some of the pharmacokinetic data that was presented earlier with Enfortumab vedotin, we think that providing patients an opportunity to discontinue Enfortumab vedotin after an induction dose of EV and Pembro may be a worthwhile strategy. We have also completed a pilot study looking at the same, which also has an EV monotherapy arm, and we don't have the final results available yet, but this IMPROEV trial is basically a step up from after completing that pilot trial.